Thursday Night Talk. This is a show where we discuss the week in Humboldt, the local issues, and the local personalities. I'm Talvi Fried, your local host for the next hour. Now, the fun questions for the day. Is Humboldt County a good place to grow old or older? What are the challenges faced by seniors living in a rural county? Is our senior healthcare situation either better, worse? Is it the same? What can you even expect from it than what you would get from urban areas? And who is working on solutions to some of the complex problems that seniors face in the region? Joining us tonight, Dr. Lindsey, president of Life Care Humboldt, and also former Humboldt County Health Officer from the years 1994 and 2011. Maggie Kraft, executive director of Area 1 Agency on Aging, and Dr. Samantha Day, Doctor of Social Work and licensed clinical social worker, also Director of Social Services for the Humboldt Senior Resource Center's Adult Day Health and Alzheimer's Services. Welcome, everybody.
Thank you.
Thank you for having us.
Yes, I like, so for those tuning in, we're talking about aging in Humboldt County. What does it mean? Can you expect from the community? What can you expect your quality of life to be like? And I want to start off with the ever fun question of what even is old? What is considered old? When can people start getting services that are meant for certain groups? I'll start off with some fun facts for everybody because I looked them up and I want to share because I thought it was interesting. 20% of people in Humboldt County are over the age of 65, according to the latest census from the United States. The average age of Humboldt is 38.9 years old as of 2020. Not sure which compared to the last 2019 census for the country was 38.1. So we are actually a little bit of an older population here. And the average age of retirement in Humboldt County is 64 years old, but you get full retirement and government benefits at 65 years old, though so is 55 old? Is 65 old? Like what are your definitions? Let's kick it off with Maggie.
Okay, so there's two questions. You're asking when do certain benefits kick in, and they're all different. The second question is, what is old, and old is defined by the person. Unfortunately, it's also defined by society, and so society defines old as, believe it or not, remember, once you're over 30, don't trust anyone over 30. So there's a lot of real societal bias against growing older, even though we spend our whole life wanting to grow older. So it's kind of a weird mix. So I would say, it's not defined. If you're talking about services and resources, there are specific ages that certain things start to happen. But in terms of how you feel and how you live your life, old's not a bad thing. And claiming your age and your experience is probably the way we should reframe it, rather than thinking, I'm old now, so therefore, because we're really not. We're only, we are who we are, and the age is not as relevant as people want to believe it is. That's my personal opinion.
Samantha.
Wonderful. Thank you, Maggie. I have to go after that. Well, so when I hear the word old, I like to think about how society defines words in general and the way we use them. A lot of time, old means about the passage of time when we're referring to items when they came from a certain age. In the vernacular, and as related to adults or humans, old often means not relevant anymore. Old often means unwanted. Old often means outdated. And in reference to a human, nobody wants those terms associated with them, in my experience at least. And a client one time told me old is a state of mind, especially in reference to those outdated, unwanted terms. And if you can avoid that, you can find the secret to life, so to speak. And in regards to terminology that might be used to people who are aging, and by the way, we're all aging. We're all aging as we speak throughout the lifespan. In the United States, the shift's kind of moving from senior to older adult, in my experience. And as Maggie was mentioning, entities like AARP might consider people over 50 in that group. One of our programs called the Program for the All-Inclusive Care for the Elderly, even though the word elderly is in there, it's for those 55 and older. Who do you know that's 50, 55 that uses the word elderly? Who do you know that's 60, 65 that uses that word? And in pure research terminology, often elderly is used to refer to the oldest of the old, people who are defying lifespan timeframes. So words really have power. It's like that whole sticks and stones may break my bones, but words can never hurt me. I'd rather have a stick hit me than a word in our society be associated with me that I don't want.
I like the terms vintage and classic.
See, you're thinking the positive ways.
I like,
I appreciate that.
why is a car from the 1950s a classic, but a person isn't? Also, fun fact, AARP has no age limit. You don't have to be over a certain age to get it. And there's a lot of benefits, a lot of discounts. And if you're a frugal person and you love discounts, I'm just saying AARP has no age limit. That's what I'm saying.
And that's a practical and a very good marketing strategy, because they used to go for 50 because it was the youngest, and they wanted to get people in the system. And now they're advertising to even younger people. And it's a good strategy to maintain, if you can get lifetime members or members starting out young, it's a good marketing strategy. And it really does show the connection between generations. And there's not this light switch at 50 that you're suddenly a different person. So I think it was a good strategy.
You hit 50 and you don't suddenly take up knitting and adopt 10 cats.
And no, actually, darn, nothing like that to look forward to.
Well, I want, since I'm the oldest person on this, I actually enjoy being old. And I'm an older adult, and I like that term. And I kind of say it's 65 because that's when you get Medicare. That's when you get, discounts on entry fees and transportation. And, at the supermarket, you get discounts. And so there's some certain advantages of that. And being retired is actually, presumably if you have some income, it's good. And I think you guys mentioned, there certainly is ageism, and a lot of us white hairs feel like we get ignored or we're not there, we're ghosts as opposed to people. But actually, I think it's a really a time to relish our experience, and we have a lot of wisdom, and I think it's a lot of cultures, it's a very respected position to be in.
Which leads me into my next question. I'm just gonna, you can popcorn it yourselves, whoever really feels urgent in this, though. So what is the quality of life and expectations for somebody who's aging or getting older in Humboldt County, say past the age of 55, or when, since it seems like the consensus is 55 to 65, you start getting most of your benefits that would come via retirement benefits or government benefits, or you being able to join Ollie at HS or Cal Poly. And so what is the quality of life that people can have, and what are the, I consider that, like, we all seem fairly healthy here in this particular panel. And what if somebody is less healthy and needs care? And, you know, I had mentioned statistics on all, or no, I didn't. 6 million people live with Alzheimer's in the US. And I'm not sure on the numbers in Humboldt County, though I imagine it's probably similar, that there's a certain percentage that have or will have Alzheimer's at some point. And what kind of life can they live? So what kind of life can a healthy person who is aging in Humboldt County live? And what kind of life can a person who really needs care get?
Just one thing that came off the top of my head was, and it's probably similar in many areas in the United States, is if you are healthy enough and you have enough money, you can live the way you want, you can age the way you want, you can stay in our beautiful community. I would love to stay here my whole life. I've been here my whole life so far, and you can do that. We know money talks in many ways. It's difficult to access specialists for healthcare here. So when you have money, you have a little bit more ability to maybe travel if you need to. You may have better insurance that allows you to access those things. And then also, if you are maybe on the other end of the spectrum and you have quite a lot of health needs, typically in our area, a lot of those people who are considered part of that group, they have specific insurances which do allow them access to programming that my agency at Humboldt Senior Resource Center, and say programming at Area 1 Agency on Aging, that is often designed for that group. But typically that's statewide about 11% of people considered an older adult, 60-ish and over. But that leaves out a giant portion of people who can't fit into either of those categories. And so that's quite difficult to find services when you just don't have enough money and you just have too much money.
Well, it definitely, the advantages are income related. You have the homeless population here is increasingly older adults. And, you know, I think that that's a sin, actually. We have more parking places in this community than we have housing.
Yes.
And you know, I don't want to make light of that. And, you know, people who live on Social Security, it's very, very hard to get by. I think that it's, you said that people who have money and are healthy and also who are able to drive. I think that
Yes.
really, that's the key to keeping connected here. So you and your friends can still drive and go to, there's a lot to do. And it's a beautiful place and a lot of fun things happening. But when your health dictates or your economic circumstances dictate you can't drive anymore, things can be quite isolating.
Mm-hmm.
Yeah, I think the experience, and they alluded to it or not alluded, just said it, the experience of aging on the North Coast really is different depending on health for sure, wealth for sure. How old you are can have an impact. Where you live in the county. We have a lot of rural areas where older adults are living that they really don't have access to many services. Race, I hate to say it, but race, ethnicity, education level, sexual orientation, gender identity, all of these things impact how you grow older in our society. And in a rural area, you add that rural isolation, you add the social isolation that can occur when you might live so rurally that you don't even have access to the internet, which is, you know, a lifeline for many people who don't get out and about a lot to stay in contact with friends, certainly during COVID and such. And so those are huge factors. The other thing is most people in the workforce now in our community and more and more in society don't work for a company that provides retirement.
Right.
And in you know, a rural community, there are some big employers here who do provide that, but small businesses, nonprofits, those aren't things that are provided. And so more and more we are seeing people who, especially those who were workers who were making lower, service workers. They used to be heroes. And I heard one say recently, well, we were heroes during COVID. Now we're nobody again, and they don't make the kind of money that is going to give them the Social Security that they really will need to survive in this community or any community lately with the housing costs. Many of them are, there was this big homeless study that came out recently. And one of the things people are saying is $300 a month, $500 more a month could have kept them from becoming homeless. And we're seeing so much money spent on the homeless population, but it's not resulting in long-term housing for enough people fast enough, because housing is very expensive to build and there's a lot of NIMBYism. But we are seeing older adults caught up in that in our community if you have Social Security and that's what you have, you're going to get priced out of the rental market. We've tried to work on some of that with our home share program, finding older adults who have housing, empty rooms that they might want to rent out to other older adults or even students who are searching for housing, and they could provide each other with, they could provide financial help, but also do some of those chores around the house that sometimes get challenging for people who are living alone. So those people between if you qualify for Medi-Cal, yes, you're going to get your health insurance, your health care covered. You still have to find the people to provide that care, but at least you're not paying for a hunting license out of your own pocket, which is for those of us working who are buying our own health insurance on the open market. We get the health insurance, but finding doctors locally who are taking new patients is very challenging. So, once you're on Medi-Cal and even Medicare, again, you've got that paid for, but finding that support and that care. But if you're just above the limits for some of those services, or you don't qualify, your Social Security might be high enough to pay for your basics, but you couldn't, and you're under 65 before you get Medicare. Those people 50 to 65, and I'm in there. I'm in the 60 plus part of that. I can't stop working, even if I wanted to, because I could not afford health insurance. So if I had health issues where I had to stop working, but not enough health issues so that I could qualify for disability or Medicare or Medi-Cal early on, which tomorrow I couldn't qualify for it if I suddenly needed it. What are those people doing? And those are the younger, older folks who are who the idea of retirement is like it's not a real concept. They are going to be working until many of these folks are going to be working a lot longer than those people who had the retirement benefits at their place of work. So you really have to look at older adults in our community very individually, based on a whole set of circumstances that impact where they are now in their lives.
It's interesting, Maggie. One is the retirement plan, but it's also, I think, because of the ageism, and younger people don't like to think about getting old and like to plan for it. When we were starting Life Plan Humboldt, the nonprofit to make housing, independent living housing here, we interviewed 14 older adults, local people, about aging. And out of those 14, maybe one had any kind of concrete plan of what might happen when they couldn't, when they got disabled or they needed a lot more help. And everybody else just kind of, I'll figure something out and hopefully I'll die quickly. And these were older people who already was like, you don't live forever no matter who you are. And it's kind of, for some people, if you don't, it's not been increasingly, it's not built into your job that you get a retirement benefit. But I think responsible employers will help people, save on their own. And
on that note, we are about to take a-
Otherwise, we've interviewed, did other interviewing of low-income adults, older adults, as to, what their future is. And some of them, like a researcher at Cal Poly, a nurse.
So we will continue this discussion after a quick break. You're listening to Thursday Night Talk. Welcome back to Thursday Night Talk. We are discussing aging in Humboldt County. I'm here with Dr. Lindsey, Maggie Kraft, and Dr. Samantha Day, a group of people who are very well versed in what it means and what the aging populace of Humboldt County is going through. Right before the break, we were talking about essentially retirement and what it means to people. And I did want to add that Cal Savers is a new initiative it's a mandated now that all employers must sign you up after 30 days within working of their company. And I work in the service industry, so as one of my many jobs, and they signed me up for this. You can choose to opt out, but they take 5% of your income every single paycheck and put it in a government-run Roth IRA. And that started as of, I think, the beginning of this year. So I'm not sure 5% of my income without any matching or any real, it doesn't feel like I have much control of what happens to that money once it disappears, though it is there. And it seems, and that you wanted to continue the discussion a little bit because I think it's interesting that you had spoken to people who are now retirement who just kind of went, well, I didn't think about it. And I feel like I've had family members who are very they've been focused all their life on retirement. They are very well prepared. They knew what they were getting into. And then I have family members who just, whatever happens, happens. And a little nerve-wracking when you're the generation that's supposed to be taking care of anybody who can't take care of themselves as they age. So I don't know if you wanted to continue more on the retirement aspect. And
No, that was a good summary.
okay,
Yes,
Dr. Lindsey had said something before the break that got me when we were talking about you interviewed 14 older adults and only one was saying that they had thought about it. If we think back to the messages of those stories that were kind of told as a society throughout the United States, even when I was growing up, the messaging is that some of the only messaging about aging is that you'll be taken care of when you're 65, you'll get Medicare and you'll get Social Security and it's fine. But otherwise, there are no transitional stories or messages that were told as a culture or as a group, unless it's done at like family levels or certain cultural levels. There's stories for what you do. You go to school, here's a milestone. You go, maybe you start a family. There's these stories for these natural life events. And then it's kind of like, oh, you're old, for lack of a better term. And that's what it is. So we're not really prepared until we get there. And when we get there, it kind of slaps us in the face. I myself, even though I'm in aging services now, and I've been for about 5 years, and my own grandmother, I've lived here my whole life in Humboldt County. My grandmother utilized services of programs that I now run. I still didn't know then what was there. I just thought, oh, my grandma's coming here. I didn't think about what I would do. Even now, I think one of the only reasons I might be thinking about it is because I'm in it as a service provider. And thinking about retirement and knowing, oh, is my Social Security that I've been paying into actually going to be available for me? Is it going exactly? I don't know. Audience, she shook her head.
and two, the thing is that that when the pact of Medicare and Social Security was made with the older people of that time, they weren't living to 80, 90, and 100. So, and the other part is what I think we're going to start seeing a trend where that longevity, which is possible if you do certain things the way you're supposed to, we are going to start seeing a trend where the younger baby boomers and the generation after them are going to be sicker and are not going to be living as long because of lifestyle choices that we're already seeing. I just heard this morning that, Humboldt County's got a highest rate of liver disease, and we have lots of high rates of diseases in our county that, and a lot of it is about lifestyle. So, no matter how much, no matter how much when we're younger, somebody who's older says, oh, you should do this. We don't listen. We don't listen to older people giving us words of wisdom. And it's rare when you do. And, and for our younger staff, very few of them are putting their money into the 403B that we offer. We don't have a match, but you can put it in there. And, once you put it in and forget it, yes, it does make a difference. It does grow, even 5%. But a lot of people aren't wired that way. And I started working with older adults when I was 25, and all my friends were like, I would know stuff that they didn't know and they didn't care about. They were like, just, we don't want to talk about this. And that's too bad, because there's opportunities there for people and more these younger folks are going to have to pay their own way. Just like Social Security was us putting money in. Well, we need more than that. You're going to need to put other money in, not government mandated, but your own mandate. Tax yourself. It's like folks are going to need to start taxing themselves and putting that money away, because if you have the wonderful opportunity to live into your 80s or 90s, you're not going to have a way to pay for it if you're not doing a little bit, when you're young, and it does compound. So, but that's, again, that whole, it's not going to happen to me, or I don't want to think about it. And that's human nature. I don't think we're ever going to find a way to keep us when we're young from not doing what we should, so that when we're old, things will be great. It's never happened in all of thousands of years. But I do think, we can just do our best to continue to let people know there's opportunities. No one ever cares about Alzheimer's until someone in their family has it. Nobody cares about nursing homes until someone in their family lives in it. That's how most of us roll. And we just have to know that, working in the field, that we just have to, when they need to know about it, we need to be there for them. We need to help them. But there's
also a factor of income issues. I would love to be able to put more money into retirement, but I have bills to pay right now, and I know a lot of other people do. Even the houseless still have bills to pay. That's the way the world seems to work. Though I want to switch gears a little bit. You had mentioned nursing homes, and I was waiting for that to come up, because there's been a slew of geriatric care, which I'm not even sure if that's the term for it, controversies within our county, about lack of care, issues with health conditions, nutrition issues, abusive staff members. And I just, who has experience with this, and what has been happening in there? Because I feel like a few homes had to be restructured in the last few years, especially during the pandemic. I feel like it was somehow like a lot of the now I'm forgetting the name, the grand jury did a report on kind of quality of life for those who are just aging and over a certain age. And what they reported was a little iffy. Like it's a little scary to be like, is my mom gonna have to go through that? And like, I wouldn't want her to. If she's very healthy and very happy, and she's got a long way to go, like 100 years before she's gonna ever get ill. At least that's what I tell her. though it's also going to happen to me one day. And what, like, I don't know what to do. I'm like, I almost feel like running away and living in a cabin is safer than the threat of what could be there in a geriatric home. And
There a widespread recognition in Humboldt County and elsewhere that, and particularly here, that skilled nursing is not very good. It's abysmal. And I think there are people working on alternatives, and the PACE program is one where people who are eligible for skilled nursing, I mean, you have to have a certain level of disability to be eligible, are assisted by comprehensive, multifaceted services to stay at home.
Age in place, yeah.
Age in place. And I think that's the same thing that drives us working on Life Plan Humboldt. Is it's a place that we're trying to build a community where you can age in place. And we'll do whatever we have to do to keep people out of skilled nursing. And that's what I participate in conferences now with people with life plan communities and aging services. And the trend is shutting down skilled nursing and really looking for alternatives. And a lot of that involves safe home environments and bringing services home. And I just want to add one of the statistics I read recently, which shocked me. So only 3% of the homes in the United States are safe for somebody who's mobility challenged.
Yes. Regardless of age, yeah.
Regardless of age. And I think that's one thing. I mean, when I heard that, I wrote to all the planning commissions and said, if you got new housing developments, you should require that they may not have to be fully accessible, universal design, but at least there should be, next to the toilets, there should be a strong beam so that if you have to put up a grab bar, you can, and make the doorways wide enough so that a wheelchair could access that. So that's for people of mobility challenged of all ages have challenges. So anyway, that's sort of off to the side, but
there's a lot of work.
I'm excited by what's happening, and we're reacting, and then we have bad things, and we're reacting, and the state unfortunately just recertified Brius, who runs the facilities in Humboldt County, although they say that they're going to have more careful oversight, but that's been lacking. And I don't think it's due to lack of goodwill on the part of the Department of Public Health. It's probably a staffing issue, and certainly in recent years they've had their plate full of COVID.
Yeah, I was an ombudsman for over 11 years and have watched the facilities here. And there's a lot of factors. I mean, in this situation, there's pure greed. That's one of the major factors, because if the staff were getting paid for the hard work they do, they would do it, and more people would do it. And so, I mean, I think one of the challenges in our society is we inadvertently vilify the people who work in these facilities when some of them are people. I mean, these are jobs that many people would never be good at and would never try. And then the people who are doing it and working hard are not getting the financial and other support from society to keep doing it and to improve their skills. So there's some things happening at the state level to try to provide incentives, cash incentives for paid caregivers to encourage them to continue this and learn more and study more. There's this movement to really look at community-based systems of care, and Cal AIM, looking at the Medi-Cal system and really focusing on trying to provide Medi-Cal services to keep people out of nursing homes. And there's, I mean, the nursing home lobby for many years, they got what they wanted. They wanted people going into nursing homes, and there weren't supports in the community. The pressure now is on to get those supports in the community. And we have, I gotta say, for a rural community, we have some programs here that don't exist in other rural places. We have the Redwood Coast Village, we have PACE, we have 3 different adult day health sites. We have MSSP, which is a case management program for people who are nursing home eligible and over 65. We have done a lot in this community to bring those services that are usually only in larger places. But I think, and nursing homes still are, the number of people in nursing homes at any given time is still not the majority, but the outcomes that we see and the sadness that we see and the people in there saying, I don't want to be here, are what we have to respond to. And even if they only have one person in them, if that one person doesn't need to be there or doesn't want to be there, we need to be working in transition to get them out. And there are some great programs. Tri-County Independent Living has a transition service program to get people out of nursing homes back into their homes. So all the services and things we're doing in our community right now are really designed to try to figure out, how do you keep people living, maybe not in their current home, because it might not be one of the 3% that's safe, but keep them living in a safe home, a place of their choosing, and not be like, well, you're going out of the hospital, you can't take care of yourself at home, boom, you're in a nursing home. No, let's figure out how to get you back home. And that's what all these community services are trying to do. So that we run them out of business. Let's run them out of business. Let's not have people go in those homes. Let's take all the workers who work in those homes and have them start working in private homes and people's homes and provide the care there. That's what we need to be seeing happen.
So speaking of services, everybody on this panel happens to be part of a group that provides their own service. And since I didn't do this at the beginning, I'd like to go around and just have everyone have a couple minutes, like maybe like 1-2 minutes real quick, just to tell people about the programs that you're with. Let's start with Dr. Samantha Day.
Thank you. So I am the Director of Social Services at Humboldt Senior Resource Center. Our main base is here in Eureka. And as Maggie was describing, we have various care programs, the main 3 care programs being MSSP, Multi-Purpose Senior Service Program, which is a state Medi-Cal waiver program for those 65 and over who wish to get services to remain in their home. PACE, which is one of the only rural PACEs in California, and it is an amazing program for the all-inclusive care for the elderly, which is a health plan program. So when people who are eligible join, they have all the providers there. It's a true wraparound, true wonderfully person-centered program, like all of our programs at Humboldt Senior Resource Center. It's wonderful. And adult day health centers, we have 2 sites, our PACE as well in Fortuna and in Eureka. And that is a day center program for actually those 18 and up with a qualifying disability. So we serve a range of people as they age. And then what has hampered us, as the other 2 wonderful panelists have alluded to, is sometimes services that are brought to our area that are affiliated with the state, we have to have certain requirements which hamper our service area ability. So because we have PACE centers, there are requirements about how far away people can live based on how long they should be on a transport to get to our clinic and our day center. And so that can preclude people in outlying areas of Humboldt County who are already further isolated from our main hubs of Eureka. And so we were able to, with 2 of our programs so far, MSSP, to open up our service area to every zip code in Humboldt County. So we can serve anybody who's eligible for MSSP in any part of Humboldt County, Whitethorn, Hoopa, Oric, anywhere. And then our newest program, Behavioral Health, where we will offer counseling services to anyone 55 and over who is eligible for individual group therapy. And that's one of my programs as well.
So real quick, you had said a few acronyms
Yes.
there. What do they mean?
So PACE is the program for the all-inclusive care for the elderly. It's our health plan program. MSSP, nobody ever says the full name because it's so long. Multi-Purpose Senior Service Program. And then Adult Day Health, which often will say ADH or ADHC, ABCDE.
Well, thank you. Dr. Lindsey, what is Life Care Humboldt?
Well, it's actually Life Plan Humboldt. And we're a nonprofit, and we're formed to plan, build, and support the first all-inclusive life plan community in Humboldt County. There's nothing like it within 200 miles. And we're planning 144 units of independent living and provide assisted living services and really innovative memory care on the same campus. And we're partnering with the Rural Community Housing Development Corporation, who will build affordable senior housing on the same campus so that we can really be accessible to mixed income levels. And the idea is to get people together. So we're going to address issues of social isolation. People have better nutrition. They'll be in universal design homes so that they'll be less likely to fall and break a hip. That will facilitate access to medical care and will really save families the anguish of dealing with somebody, an older person who's disabled at home. And the older person will be supported. And so families can interact with them in a pleasurable way and not in an anxiety-provoking, guilt-inducing manner.
Thank you. And we're going to take a real quick break and then we'll get back so that to Maggie describing the services that the Area 1 Agency on Aging provides. You're listening to Thursday Night Talk. We'll be right back. Welcome back, everyone. You're listening to Thursday Night Talk. We are here with Dr. Ann Lindsey, President of Life Plan Humboldt, Dr. Samantha Day, DSW LCSW, Director of Social Services for Humboldt Senior Resource Center's Adult Day Health and Alzheimer's Services, and Maggie Kraft, Executive Director of Area 1 Agency on Aging. If you are just tuning in, well, make sure to go on YouTube and rewatch all of this because it's some fascinating information on resources available to those who are aging, to those who have older members of their family that may benefit from these programs, as well as some other discussions in there, like what is aging? What is being old? What are the definitions of the panelists here? Though, Maggie, I wanted to give you some time to let everybody know, since we had given time to everybody else right before the break on what their services were and what is Area 1 Agency on Aging.
Well, we kind of do a couple different things, and we have some direct services we provide, but one of our major roles is to receive Older Americans Act funding from the federal and state governments and distribute that funding locally to services, to provide services that are required under the Older Americans Act. And with that process comes monitoring and contracting and all that stuff that's not that sexy, but it's really important because if we didn't do it, that money wouldn't come here. And that money comes to this community to provide caregiver services through Redwood Caregiver Resource Center. It comes and provides services through Legal Services of Northern California. We also contract with both Del Norte Senior Center and the Humboldt Senior Resource Center to provide nutrition programs, both what they call congregate meals, which is when people come to the setting and eat lunch together, and home delivered meals, Meals on Wheels, that are being provided throughout the two counties. And we don't fund those programs 100% because the government is not that generous. So all of these organizations have to find other funding sources to match their funding and do fundraising and all those things. But we bring the line, a good chunk of that money here. We also are responsible for creating an area plan. Every 4 years, we write a new area plan and we update it every year, talking about how the money that does come here through the federal and state government is going to be spent on required services and then other types of things. And that plan also gives a good overview of the population in the two-county area, what the issues are, what our unique challenges of this community space is. It talks about other services that are provided by other entities and how these things kind of work together. We don't fund all the services. There's many partners who provide services to older adults and people with disabilities in our communities, including the counties. And so part of our role is to make sure we're talking to these other groups and understanding what they're doing and how we can work with them to stretch those dollars. We get that money based on population. So if you look at our population base compared to LA, when LA gets $7 million, we get 100,000 as, you know, as a rough kind of equivalency. So, so area agencies throughout the country and throughout the state of California are very different based on population base, because that's where the money comes. And so we have to be pretty creative in this community to make things stretch. Some of the programs that we provide directly are the long-term care ombudsman program, and that advocates for people in the nursing homes we were talking about, as well as residential care. We have a very popular program called HICAP, which means Health Insurance Counseling and Advocacy Program. And that helps people sort out Medicare. Medicare, you know, you turn 65, yippee, you're on Medicare. And then you have to figure out a whole bunch of stuff about Medicare, like which drug plan and which of this and which of that. And it can be very confusing and challenging. So we have staff and volunteers who are trained to support people and help people with that process, get them signed up for Medicare when they're turning 65, all that fun stuff. We also have an exercise program, which is called SAIL, and that helps, it's evidence-based, and we help folks stay strong and healthy, strong and active and independent for life, I guess is what it's called. We have some CalFresh funding now that we are doing more exercise classes and really targeting Del Norte County for some outreach to get more of the older adults in Del Norte County on to CalFresh. Their numbers are pretty low compared to percentages of people on CalFresh here in Humboldt. So we want to get that happening. We also
explain what CalFresh is, Maggie.
Yes, thank you. So CalFresh is people qualify. It's extra money to buy food. It's designed to help make sure people are buying fresh, wholesome food to supplement what they're getting on their own. We have an issue with hunger in this society and in this county also. And if you're living on fixed income and prices, we've all seen the prices in the market go up. If you're on fixed income and you're saying, oh no, I don't want CalFresh, that's a handout. It's like, no, you've paid taxes. It's paid for with our taxes. It's there to make sure you stay healthy, because if you don't eat well, then you might get sick and have other health problems that are much more painful and much less fun than eating a salad. So we really want to get more people signed up for CalFresh to supplement their budget so they can buy the food they need to buy. We have our information assistance program is kind of the hub where, like, if anybody is out there going, I need to call somebody, I have no idea who I need to call, I just woke up and realized I need something, they call us. And if we can't help them directly, we refer them to the senior center, we refer them to different kinds of programs. In that information assistance, we also refer them some of our programs, including we have a transportation program. We drive people 55 and older, or 50 and older, to doctor's appointments, do grocery shopping, anybody who can't drive themselves or shouldn't be driving themselves. We have that program. We have a home repair. It's not called home repair, it's called fall prevention, but we assess people's homes for safety, and if they need fixes that they can't afford to do, we have a grant that we can help do some fixes. Some of them can be fairly major, but it's all about safety and keeping them from falling, because people who fall at home end up in nursing homes. And if these are avoidable falls, let's keep them at home again. And all our programs are about keeping people home, living healthy and safe. We have another program called Stay Put, which is kind of like the fall prevention, but it's we do things to help people remain independent in their home. Prior to a few hours, maybe we help them sort their bills or, do some household kinds of one-time chores and things to keep things going. And then I mentioned the home share program, which we have, where we match people up with housing with people who need housing. I wanted to point out, Senior Center also has added some new programs. I got your letter. They have some great programs. One of them is they have a program to help with pets, to help support the nutrition of pets, as well as the nutrition of the pet owners. And they are, Redwood Coast Village has just joined Senior Center as a new service there. And again, we are one of the few rural villages in the state too. Again, people came together and said, we need this. And that's all about providing chores and activities and things to these people so they can remain independent living at home. And it uses volunteers. So all of our services depend on volunteer support. So if you're sitting out there,
we are now
go ahead.
Going into the round robin time. So I'm going to give you another 2 minutes, and then I'll give everybody else another, let's say like 4 minutes. Just and you can talk about whatever. Well, 2 to 3 minutes apiece is pretty much how it works, but we'll see how that goes.
Well, I was almost done. So
okay.
I was.
Time starts now. You've got 2 to 3 minutes.
Okay, fine. I was going to say, oh dear, now what do I say? So I think what I wanted to say is that volunteerism is something that we know now is something that keeps us healthy, keeps us engaged and active. And one of the things we've seen a lot of studies come out about health, how we influence our own health, what our behaviors are. And one behavior that is really critical to self-care and health is being connected with other people in the community. And one of the best ways to do that is volunteer. So I want to kind of put that out to folks. There are programs at the Senior Center looking for volunteers. I mentioned one. They also use volunteers in their meal delivery and their nutrition programs. I know Anne has a whole great team of people volunteering to help make Life Plan Humboldt happen. And we use volunteers in all of our programs and services. One thing we are working on that's fairly new is the Aging and Disability Resource Connection, which is us working with Tri-County Independent Living, North Coast Information, and North Coast Health Connect. Anyway, I got them wrong, but we're working with them as core partners and a lot of different agencies to really look at the system of how we provide care, how we coordinate care, so that we get away from me calling Samantha and saying, I need PACE. And then she said, okay, fine. And then I end up going over here and I need grocery shopping, or I need this and I need that. And we keep sending people to different things. We need to do a better job as service providers of saying to whoever comes to our doors, like, if I can't do it, I'll find who can. I'll find who can help you, and not just give you a phone number and scoot you out, but really provide that wraparound support and services so we can keep people living independently in their place of choice and not have them so stressed out with those phone calls they have to make to people. Think about the phone calls you have to make to medical care providers and the stress we go through. So that's the goal. The vision is to make the system work better for the consumer. So
thank you, Maggie. I appreciate your contributions to the show. What is the website for Area 1 Agency on Aging?
It's a1aa.org, and the 1 is the new number not spelled out. So a1aa.org.
Thank you so much.
Thank you.
Let's go over to Dr. Ann Lindsey, and you get your time, a few minutes to discuss whatever you'd like listeners or viewers to take with them.
Well, one of the things I think Humboldt County has, it was touched on, we have services beyond what you might expect for a rural area. And that's because people here want to solve problems. And we've got innovative homeless programs. We've got Ollie, the senior education at Cal Poly, and they were told, oh, you're too small to have one, but Ollie's been successful. We have the PACE program that Samantha really explained adequately, nicely, and that's unusual for a rural area. We have the Village, which is also unusual for a rural area to have such a volunteer organization that supports older people in their homes. And Life Plan Humboldt, I think, is, it's also unusual, and we're getting where we're getting because of volunteer power, the grassroots support, and we were able to attract support from a network of Quaker Life Plan communities nationwide. And the thing that brought them to us is not that we're the richest community in the world, but we're the most dedicated to making this happen. And that all the people that are just chipping in to solve this problem of keep getting people supported in a community where they can age in community. So it's really credit to Humboldt.
Thank you so much for being on the show. And is there a website for people to find out more information?
Yes, lifeplanhumboldt.org.
Keeping it simple.
Updates and make a donation if you'd like. And also complete the survey actually there. It's very important. We want input from people. You could learn all about what a life plan community is. I haven't had time to go into that, but you can learn all about, and let's take the survey. You'll find out about what we're planning. You get your input on what you think would be important in a life plan community, because we want to design it with the community, not just for the community.
Well, thank you so much for being on the show, Dr. Samantha Day. Any final closing thoughts? You've got about 2.5, 3 minutes.
Yeah, so I had mentioned earlier our main care, our health wellness programs at Humboldt Senior Resource Center. But as Maggie alluded to earlier, one of our foundational programs is our nutrition program, Unsung Hero, Backbone. We know how important nutrition is. And to talk about social isolation, that is one of the #1 programs that reaches people, especially our Meals on Wheels. When we go to people's homes, sometimes that's the only contact they have. And just that friendly face at that one time can improve so much about one's life. And my main passion is wellness across the lifespan and predictors of health. Some of the #1 predictors of wellness across the lifespan is maintaining social connection. And so addressing the duality of social isolation and the accompanying loneliness that occurs is really important to our mission here and at Humboldt Senior Resource Center. And so with some wonderful funds from Area 1 Agency on Aging, we are trying to test some new ways to address social isolation for older adults in our community by integrating things like intergenerational interactions. And for me, I'm doing it from a behavioral health perspective because that's my milieu. And so thinking about how right now we're running a pilot program that is half older adults and half people between 20 and 40, because when we have that intergenerational piece, you're going to do things like reduce ageism, which is one of the #1 contributors to social isolation in older adults in the United States, both within older adults themselves, as well as younger people. So we're aiming to not only improve mental health outcomes through therapeutic techniques that are traditionally used in like individual or group therapy, but by adding things like storytelling, which is culturally responsive, has been in cultures across the globe since time, the beginning of time, and putting people together instead of isolating them. We're hoping to address not just those depression and anxiety symptoms, but those things that cause it, sustain it, and keep it going in our community and in our country. And we are very grateful to be in Humboldt. I'm very grateful to serve the community that I live. I'm from Humboldt, as those of you here know. If you've lived here your whole life, you can proudly wear that Humboldt badge of honor. And we just look forward to continuing to partner with people like Dr. Lindsey and Maggie Kraft and keep our aging population, which is everyone, safe, happy, and healthy.
Thank you so much. Is there a website people can go for the Senior Resource Center to find out more information?
Yeah, so it's www.hum, as in Humboldt, HUM, senior.org. And we have a range of services. You'll be really impressed. We're starting some pop-up serving sites for our nutrition program, and you have seen nothing yet from what we got coming.
Well, thank you so much for being on the show. Poppy, my dog, is telling everybody it is the end of the show, and it will be back next week, of course. That's all the time. Thank you again to Dr. Ann Lindsey, Maggie Kraft, and Dr. Samantha Day for being panelists on the program today. You can rewatch the show on Access Humboldt's YouTube channel. Just look up Access Humboldt. There's a playlist called Thursday Night Talk. Check it out. Just keep it going for a couple hours and you'll have caught up. I think this is our 20th show that I've done or been hosting, so yay. And it'll also be playing on Channel 12 throughout the weekend on our Access Humboldt TV station if you have an old school TV, which quite a few people seem to out here. If you have any topics or suggestions for the show, please email us at kzzh@accesshumboldt.net, and we'll be replaying the show on 96.7 FM, of course, KZZH, what you're listening to right now, Friday evening at 8 p.m. I will see you next week with a whole new panel, a whole new topic, and more, just a bunch of nothing but localness. And hopefully we'll figure out all of the world's problems. But if we don't figure them out, we'll at least discuss them. Have a good weekend.
Thank you.